All right, everyone. Welcome to our webinar on race and public health. As we dive into a very deep discussion, I want to welcome all of you who are attending, and I want to welcome my fellow panelists, Golene Samari, Charles Branis, Bob Fullylove. I am going to start with the Mailman Land Acknowledgement. We owe our existence and vitality to those before us who've contributed their hopes, dreams, and energy to making the history that led to this moment. Some have lived on this land for more generations than can be counted, and some have been brought against their will. We are gathered on the occupied and unceded land of the Lenape peoples, and I encourage you to think about the land that you're gathered on wherever you are. I am still gathered on the land of the Lenape as I'm in Brooklyn. I ask you to join me in acknowledging the Lenape communities, their elders, both past and present, their descendants, as well as future generations. We sit in spaces funded, governed by, and named for families who derive their wealth from the transatlantic slave trade and plantation slavery. I ask you to join me in acknowledging the enslaved African peoples, their elders, both past and present, as well as their descendants and their future generations. Columbia University acknowledges that it was founded upon the exclusion and erasure of many indigenous peoples, and that slavery has been intertwined with the life of the college and the university. This acknowledgement demonstrates a commitment to beginning the process of working to dismantle the ongoing legacies of settler colonialism, violence, slavery, displacement, and migration through ongoing education and responsible representation. Before we get started today, I want to give you an overview of the way that our time will be structured. After Dean Freed's opening remarks, our panelists will introduce themselves and briefly speak to how their work contributes to our understanding of systemic racism and white supremacy. Following that, the floor will be open for comments and questions. Many of you sent your questions ahead of time, and so I have structured those questions to guide our conversation from awareness to action. And following that, our dean will close and let you know of next steps. Are we ready to hear from the dean?
With apologies, she's still not able to get on the Zoom. We're not quite sure what the issue is, so I do think you should proceed. Thank you.
Okay, so we will hear the dean's remarks at the end, or when she's able to join us, I may quickly segue to her just because her remarks have a lot to do with framing this conversation. All right, so let's get started. Charlie, Golene, and Bob, if you all can take 3 minutes each to introduce yourself and speak to how your work contributes to our knowledge of systemic racism and white supremacy, that would be great. Who would like to start? Okay, Golene.
Sure, I'd be happy to start. For those who don't know me, I'm faculty in population and family health. My name is Golene Samari. My research focuses on the intersection of social inequities in health on the basis of race, migration, and gender. So that's the academic jargon way of saying that my research focuses on structural racism, xenophobia, and the racialization of religious minorities and how these systems affect health, health outcomes, health behavior, healthcare services, access, and so on. First and foremost, I'm an ongoing student of anti-racism work in public health, as I was trained by the first generation of public health scholars who discussed the structural racism and health, including Chandra Ford and Gilbert G. So structural racism includes segregation, racial ideology, policing systems, and other institutional policies that are difficult to perceive. Second, I'm a public health scholar who attempts to dismantle the systemic racism that prevents the achievement of health equity. So my work really builds on the work of past public health researchers and population health demographers that have been doing this work for decades to try to achieve racial health equity. And I think for this conversation, it's important to let me give you a brief history of the racism work in public health pulled from a book that I'll mention in a bit. So in the 1950s, there was an increase in civil rights efforts. By the 1960s, these efforts included health-specific activities such as expanding access to quality medical care. By the 1970s, it was clear that medical interventions alone would not erase health inequalities. By the 1980s, health equity champions fought for the recognition of social interventions to improve access to care. By the 1990s, there was a growing acknowledgement that the underlying barriers to effecting change was racism itself, and the term health disparities arose. Several organizations, including the American Public Health Association, developed policies on reducing health disparities. And since 1991, examination of racism in health has grown. By the late 2000s, the inquiry expanded to the acknowledgement of structural and systemic racism. And by 2015, myself and others have pointed to the intersectional nature of racism and other forms of identity. So my own work points to the legacy of Islamophobia that has accompanied anti-Black racism in the United States since the creation of this country, and how that operates at multiple levels, much like racism, to affect health. My work points to the racialization of religious minorities and how racism and xenophobia affects health of immigrants. So improvements have been made across public health to document such health disparities. However, a significant majority of the public health research that points to health disparities also fails to acknowledge racism as the underlying mechanism behind health inequities. In 2019, myself and Dr. Fullilove contributed to a book entitled Racism, Science and Tools for the Public Health Professional. It was deemed radical that the word racism was included in the title. It is my strong belief that you should not do public health work if you cannot recognize the systematic racism that underlines all of public health efforts. And the field of public health must continue to be on the front lines of that fight, because racism unequivocally contributes to health inequities. And if you haven't joined the public health efforts to tackle racism, now is your opportunity to actively join in the struggle. Thank you.
Go next. So thanks, Regina, and great comments, Colleen. It's ironic. I'm sitting here in my home with my family just outside. I should be comfortable, but I have to confess to you that I'm quite nervous addressing you all. So rather than just focus on my work, I'd rather take my 3 minutes to mostly tell you what I see. I feel like now is the time to listen and amplify Black scholarship and activism and recognize privilege, so I'll be brief. The first thing I see is people of color, friends, neighbors, colleagues, and students hurting and being hurt. This has been going on for far too long and in far too many places. As a white man, I can't fully grasp how this feels, but I see it nonetheless, and I want to do something meaningful to make things better. In my own work on gun violence, I regularly see neighborhoods where Black and brown folks have been violated as a matter of formal written policies often set down by their own mayors and city councils in the form of relocation, redlining, and luxury development. We must recognize that Columbia University has a long and problematic relationship with its own surrounding communities and its criminalization of Black residents, students, and faculty. Police jurisdictions around the nation are the #1 largest budget items in their municipalities. We must seek to defund and meaningfully redirect policing budgets to social services, education, and public health. I also see scientific colonialism and scientific racism not simply as unjust and pervasive, but as real threats to creativity, innovation, and progress. We empirically know that diversity means better ideas, better science, and in the end, better health. Racism is about the distribution of money, opportunity, and power, and this is ingloriously raised up in the ivory walls of science that our Black colleagues are forced to climb in ways that those of us with privilege are not. I see a school and almost all departments in our school with a century-long history devoid of having people of color in roles as deans and as chairs. We must do better as a public health community committed to racial justice and redress the long-accepted patterns of white supremacy in the academy and beyond that. I see a Black and Latinx student caucus that has given us, the Mailman School and its leaders, the gift of their insights in a clear letter that is an impressive act of selflessness and grace. Thank you to them for their leadership. And finally, I see the need for words, but mostly a need for sustained action. So, Zoom fatigue is already upon us, and I feel that we will soon have statement fatigue without starting on a path to solutions. we can't be satisfied with simply documenting and describing. We must also intervene and implement. I'm hoping that our conversation today starts us on this path. Thanks very much for the opportunity to say something, and with great respect and sincerity, thanks to Regine for her wisdom, teaching, and leadership amid what I think is an enormous opportunity for change.
Wow. So good afternoon, everyone. I'm Dr. Robert Fullilove. I'm currently in my 31st year as a member of the faculty of the Mailman School of Public Health. I guess more appropriately it would be the Columbia University Irving Medical Center. And I think the best way to describe the work that I'm engaged in now is to tell you a little bit about my past and the degree to which it has basically provided the format that I've used in much of the work that I've done here. 56 years ago, I was a field secretary of the Student Nonviolent Coordinating Committee. I was a college student who went south to Mississippi in 1964. And part of the way in which I try to understand my experience with SNCC in the old days is to understand that viewed from the standpoint of contemporary events, my career as a civil rights worker was bookended by police violence. The very first day of Mississippi Freedom Summer, 3 of our colleagues were killed, Goodman, Cherney, and Schreiner. We thought through that period that part of what we were revealing was the degree to which the social controls that were so prominent in the South in segregation were basically tools of the manner in which police were deployed both during the times of slavery as well as during the course of the civil rights movement. The end of my career with SNCC ended when SNCC basically disbanded. It was in 1967. I was living in Newark, New Jersey, where I was raised. I was part of a group that was organizing housing projects in the city of Newark. The 1967 Newark riots, which killed 44 people, were part of my life as a community organizer and as somebody who was really concerned about the relationship between community health and the presence of police violence. It's important to understand that that riot, that rebellion, that bit of urban unrest was started when police roughed up a cab driver and created the turmoil that ultimately resulted in that period of destruction. Something that, if you know Newark, New Jersey, still exists to this day. There are parts of Newark that have never come back. And the fact that 53 years later, I am now viewing things in every place from Minnesota to places throughout the United States, I'm seeing us relive much of what I saw as being so horrific in the past. Since 1991, I was appointed by Alan Rosenfield to be the Dean for Community and Minority Affairs. Much of what I've done has been to face outward into the community that we exist here in Washington Heights, as well as in New York City and the New York metropolitan area in general. One of the things that I'm here to do is to recruit folk to what I consider to be the most important work that we can do at Mailman, which is to become more visibly engaged in the public health of the community that surrounds us. Some of you were present this Saturday when we did Heal the Heights, the 16th anniversary of Hike the Heights, where instead of hiking throughout Washington Heights, we took a visual tour of the community with 2 of our representatives, Al Taylor, who was our assemblyman, Robert Jackson, our Muslim state senator. We went to places where police violence in this community in the 1990s was part of what creates the fabric of what we as a nation are dealing with today. I'm here to recruit students and faculty to become more engaged in what's going on in the Washington Heights. The most important thing that was revealed in our tour of the community was food insecurity. We were handing out food. We were handing out food and sandwiches. And it's one of the ways to sort of understand how much and to what degree much of what we talked about in public health must be balanced by what we see and what we experience in communities. Ours is an approach that is not just about observing, collecting the data, and making sense of it. Ours is also about making witness. Public health only works when it's in the communities that are struggling with issues of public health and is able to do something concrete, able to do something positive to affect what's going on with the folk who live there. All of a sudden, my phone is exploding on me. Part of the other thing that I'm involved with is the Bard Prison Initiative. I think it's really important to understand that for the last 10 years, I've been successful in getting real attention paid to the degree to which education can be one of the most important liberating factors for a community that sees more than 1/3 of its young men locked up and doing time in prison. The Bar Prison Initiative has given us to date 4 Columbia University graduate students who've left this institution who are currently working in their communities. They wish to be engaged with us, and much of what I'm doing as the Dean of Community and Minority Affairs is strengthening the relationship between this group that wants very much to do something concrete about public health and has unique access to many of the communities where we do our work. I think that more than anything else, I think of myself less as a researcher and more as somebody who started professional life as a community organizer, started doing education in Freedom Schools in Holly Springs, Mississippi, and continues 56 years later to say, we should be doing this. We have this within our midst. Public health students for me are the exact replica of the students who went south to Mississippi in 1964. We're the ones who are saying racism equals poor health. And to the degree that we not just study it, we actually act upon it and do work to improve the lives of the communities that we're engaged in, that's the degree to which I think we really see the mission that all of us have embraced as public health professionals actually become a reality. Let me stop there.
Thank you so much for your comments. And now, Dean Freed, this is a perfect time before we get into discussion to hear a little bit more about why we're gathered today and what next steps are.
Thank you, and thank you to all of my colleagues for going first while I was stuck in an internet scramble, but I think appropriately going first because of each of your commitment, passion, and leadership, which we work together so much to enact. I'd like to start by thanking each and every one of you who was here with us today, in addition to my colleagues who are speaking. And to say how much I and we all feel that it's essential that more than ever that we come together as a community on these issues that confront us. We recognize that our school of public health is an imperfect community embedded in a country with a deeply painful 400-year history of systemic racism and oppression. And this is woven into the very fabric of our nation and seen in so many ways, including the most recent police killing of George Floyd. These critical issues that have escalated necessity and urgency and bring us together today. Our understanding of racism as a public health issue that Golene and my other colleagues have just laid out so well. But particularly that all of us who are white have to own the experience of the privilege of being white and how we contribute to that. We have to resolve that critically, and that brings us here today. And we acknowledge that while we have worked intentionally, seriously, and with commitment and taken many positive steps now over many years and made some progress to remove systemic racism, to become fully diverse and inclusive, to become anti-racist, and to lead into a fully inclusive, caring, valuing, and respectful community, it is not enough. And this brings us here today. We still have much further to go to live an anti-racist, multicultural institution that we are committed to, and to offer a model, we hope, for what it takes to get there. In the wake of the racist murders of the last few weeks, on top of the disparate effects of COVID on Black and Brown communities in our city and our country, and in the context of long-standing systemic racism, it is critical to now propel our school and our partnerships forward to define really transformational goals and actions. We have a responsibility as public health leaders in a leadership institution wholly dedicated to resolving the health inequalities that result from racism, to put the full weight of our leadership and our whole community into agreeing on the next stage transformational agenda that is required. And this brings us here today. This morning, our school's entire leadership team, comprised of all deans and vice deans, education leadership, chairs, research center directors, and other senior leaders of this school unanimously committed to identifying and creating the actions that will be important and transformative for all of us, students, faculty, and staff, and with our community. We will initiate the formal work next week through the creation of an action team that will bring together the expertise, such as what you have just heard in my colleagues, the passion, the vision of students, faculty, and staff to lead in identifying the immediate actions needed and the roadmap for our future. We will work tirelessly so we can achieve our goal. We owe our community, and most especially those who are most marginalized, nothing less. I'm eager to continue this conversation tomorrow with members of the Black and Latinx Student Caucus, who sent me and other school leaders a very thoughtful and important letter laying out changes they believe and are convinced are needed within our community. And I'm very proud that our students lead in such important, forceful, and insightful ways. Thank you to all of you. And I very much look forward to speaking tomorrow and learning more. In the meantime, please watch your email for information about the action team's charge and how everyone can participate in coming days. Today's webinar is an opportunity for all of us to learn from one another's expertise and lived experience, which will help us to share and build our institutional plan for next stage action. To ensure maximum time to hear from all of you, I'm going to stop here and turn the floor over to Dean Regine Diacqua, Assistant Dean of Diversity, Culture, and Inclusion, who will serve as today's moderator. Regine, thank you for your leadership.
Thank you so much. And now I'd like to turn to questions that have come from our current students, alumni, and some incoming students. And so the first question I'd like to ask from our community and faculty and staff as well is, what can we as public health professionals do to better frame police violence and racism as public health issues?
Forgive me, I'm really quite interested in ways in which we first focus on community-police relations. There are two issues that are really critical. The defund the police is not let's get rid of the police altogether. It's recognizing that we're so much about social control in this country that we've used our police force to deal with homelessness, mental illness, and just about any social problem that we don't want to invest in as a society, but which produces outcomes that often put people in situations where they're confronting the forces of the law. Take that away, and what you leave are what used to be the ways in which communities looked after themselves, their safety, and their health. It's interesting to note that the 33rd precinct is a relatively new precinct. It arose out of the 34th. It's right here in Washington Heights, and it has a history that goes back to the 1990s when police violence and the drug trade that was so much a part of Washington Heights created a lot of deadly scenarios, much of which we saw revisited when we had a view of the history of Washington Heights this past Saturday. Interestingly enough, Coach Dave Crenshaw, who's one of the folk that many of our students have worked with over the period of the years, is someone who has worked very, very hard to make the 33rd precinct a precinct that serves the community, and it is not so quick to judge its young people as potential criminals that need to be controlled. The 33rd has actually invited us to be a part of an ongoing community dialogue about how to make community policing work. I want to be clear that all of our efforts to make sure that we understand how to deal with the problems that are created with an occupying force, that is often what the police turn out to be, is a very different thing than what happens in a community like this when every final Thursday of every month, members of the community go to the 33rd precinct to sort of talk about ways in which the police can help them. I'm someone who is really clear. I work in prisons where the people who are there were put there by the police and by the courts. The whole notion that somehow or other we are trying to achieve some sort of balance. Policing as a service to the community instead of as an occupying force. Police as part of what communities must have in order to make sure that their children grow up and the kind of safety that we all know is so important. But also having community voices heard, not just as a part of what we're doing to control the issues that created Minnesota, but also just as a way of understanding that in a democracy like ours, the voice of the community has to be more important than the voice of law and order. And one of the ways we do that is to create the kind of partnerships where discourse between the folk over there and the folk over here produces something that looks like justice and produces something that looks like a true democracy. I think that we're in the school trying to work towards that end. Once again, I keep bringing up how much it's important for this institution to be involved in this community. We often describe it as a laboratory where we learn really how to do public health that's effective. Let's take the events of the last 2 months, use them as a template to do things in this community, because I know we're able, and I know we have a very large number of students who are anxious to do exactly that. Charlie, can you say something about your own research? Because I've been trying to exhort you to think about the relationship between what we know about guns and the rise of the police here in the United States. It does set police forces here apart from everything you're going to see in many countries throughout the world. And I think your research has a lot to say about that.
I will, but I'm gonna let Golene go just for a second because I think she pulled this up.
I was just going to build off with what Dr. Fullilove was saying, in that I think defund the police is actually a rally call to public health professionals everywhere, because fundamentally that is saying that we need to invest in community-based and social programming, which, if you believe in the principle of public health and prevention as the source of intervention and building safe and healthy communities, then you believe in this notion of bolstering social programming and bolstering social determinants of health that prevent those disease outcomes and health inequities down the line. So every public health professional should be on board with this notion of defund the police and invest in places that we know are social determinants of health and community well-being.
And I have to tell you, so first thing, Bob, your comment about firearms in the U.S. and that this is not, it's not by chance that our law enforcement and military have just skyrocketed in size. As I said in my comments, I mean, you can go to pretty much any city in the U.S. It is by far the #1 budget line item in any municipal budget is the police department. I've seen that. And you know what it does too, I have to tell you, it spills over into our work. All of a sudden, they're not just social workers and other mental health experts and so forth that the police are being asked to do. They're also the best data collectors in town. And that's a big problem for public health. So I'm gonna agree to a point about community policing. Having watched it, it's not something I study, but I've hung out with social scientists that have studied it for years. And I think it hasn't achieved even close to what the intent was. And that goes for things like focused deterrence and other approaches that are this mixed blend of community services and policing. They simply end up redirecting things into police coffers that don't get used for the right reasons. So I think Golene is absolutely correct. Defund the police is a line item, a tagline, but we need to redirect that money into things that matter, things that are not policing at all. And I will tell you, my experience in Guatemala, being there in the years after the Civil War, when that exactly happened, we have to be very careful what the redirection of funds does. You know, in Guatemala, what happened was they now have the largest private security forces in the world after defunding the police. And by the way, it's led to resources going into vigilantism and so forth. So we have to be very careful that we move those funds out of police coffers and into things like social services, public health, housing, education, things that are not police services.
Thank you so much. And diving a little bit deeper, what would it look like, or how would we look if we as a field, as an institution, actually centered racism in public health?
I'm gonna contribute some thoughts, keeping in mind that I'm still fairly new to this institution. But I think that public health curriculum across the board needs to have a racism and systemic racism lens. I think that it needs to be included in a whole range of coursework, and it's largely applicable across the school in general. I think that contributing to this work requires changes at the institution level itself, and we have to transform the institutions that were created in the backdrop of racism in order to actually create a pipeline of health professionals that are engaged in creating health equity. So for me, the way that I have engaged in this anti-racism work is, for example, creating in collaboration with your office, Dr. Diacqua, the student organization, the student faculty mentorship group called Mosaic, and it's to mentor students and faculty and ignite community between them. And it's for students of color and first generation students. And it's important to explicitly have those spaces. So even an institution that's educating in public health or doing this public health work, creating those spaces for the future professionals is a huge part of the anti-racism work that happens here.
Goleen, Dr. Samari, can you please tell me a little bit more about transforming the institutions that have been formed against the backdrop of racism?
Sure. So to me, that means really actionable things: elevating and supporting Black leadership, elevating and supporting Black scholarship, elevating and supporting scholars of color and leaders of color. It means putting the resources behind the people that are doing the scholarship and demonstrate this critical understanding of these things that have been created. It's one thing to really like think and have a good idea, but it's taking actions to change those institutional structures. Now, we all know Columbia University, a prestigious university, was created in Washington Heights, erected in this neighborhood that Dr. Fullilove talks about so brilliantly, and having that community engaged piece of it is also critical to dismantling sort of this disjointedness from that institution to that community. So it occurs on a lot of levels, both from the curriculum to the faculty to the staff, and it's really just intentional action and resources in order to do a long-term, it's not going to happen tomorrow. It's a long-term engagement and effort to dismantle years and years and years of things that have been created in the backdrop of racism.
Any other comments?
Yeah, I would just add that, and I think, Goleen, you're absolutely right. Part of what this means in the simplest possible terms is that we train people to be deliberate about unmasking and dismantling racism wherever they see it, whether it's in health, whether it's in the way we do research, whether it's in the way we plan our cities and towns. And most especially, it would have to do with how we make access to medical services available. I believe that this is not only something that becomes our central educational mission, I believe it's something that we would continually assess and evaluate as to whether or not we've reached our goal. It's one thing to put it up in a plaque and maybe even translate it into Latin. It's another thing to actually see after 2, 3, 4 years, what have we done? What have we wrought? What have we produced? And what could we do better? So the intention is to act in this regard, but it's also to assess and evaluate what we've done so that we can get better. A continued, enduring commitment to do this, I think, is absolutely essential for any institution like ours that plans to be relevant in the 21st century.
We have a live question from the audience about gentrification. Given what we're talking about in terms of dismantling those institutions that have been built against the backdrop of racism, how does our position in this community impact what's going on, and how do we change the way that we navigate and live and work in this community as an anchor institution?
I think there's a great piece that came out a couple of years ago by Ta-Nehisi Coates. It was called The Case for Reparations, and it was talking about reparations for slavery, but in it, there were maps of a number of different cities, including Detroit and Chicago, and those were redlining maps. And I think it's astounding that those maps from 60, 70 years ago, more or less, to be honest with you, not that much long ago, you can go to those same maps, and those are the same neighborhoods that we're being called into and that folks, public health people, are working in right now. I mean, I think the the issue for gentrification is that it remains with us and is so widespread and then gets reproduced by eds and meds in their local communities. We have to take care not to do that, to assimilate better into communities and not to think about things like luxury developments, to think about improvements to communities rather than imagining how it's going to improve, for instance, for medical centers, how it's going to improve flow of patients and somehow affect the bottom line. We need to follow the case of things like Nationwide Children's Hospital in Columbus, Ohio, where they built 250, 300 homes in the community out of their money, didn't ask the community for anything, that sort of thing. And it had nothing to do with their bottom line. They went to improve the community with affordable housing. These sorts of things need to happen for the surrounding area in a thoughtful and in a way that the community comes to the table and tells the medical centers and the universities what they want, not simply putting up new buildings in the surrounding community.
I think it's fair to say that if you do work in this community and you're talking to a community group as someone from Columbia University, typically the first thing you do is say something like, "Hi, I'm from Columbia. I want to apologize because I know we haven't been the best possible neighbors." Let's be clear that the community perception here in Washington Heights, as well as in Central Harlem, is that Columbia University is driving a lot of gentrification. And I know that that question was basically raised to see whether or not we're in a position to acknowledge it. Here's what I think has happened with COVID-19 and Washington Heights. I think the reset button got pushed. Coogan's disappeared. It's no longer here. Many of the institutions, many of the businesses that were part of this community are about to fold. Our notions about how do we rebuild New York City should begin with us, and how do we rebuild Washington Heights? And if I can borrow from Charles' notion, part of what we have to do is acknowledge that we haven't always been the best neighbors. And we pretty much have to commit to understand that if this neighborhood is going to come back, preserving the diversity that's here now, preserving the notion that this is a largely Dominican community, we can't be involved in the redevelopment of Washington Heights to create a community that is basically built in the image of Columbia. If we are truly about anti-racist work, then preserving the diversity that exists here, strengthening this community, and seeing gentrification as investing in the urban infrastructure has to be a part of our mission. And I know that it's going to be difficult. My sense is that there are two souls in Columbia University. There's the part that's the corporation, Columbia University in the city of New York, and then there's what we do. Then there's who we are. Then there's what we're about. I think this is the point where we get to say to the corporation, I'm sorry, in order for us to be a relevant part of this community, in order for us to be a relevant institution in New York City, we have to think about the ways in which we have been responsible for some of the urban development that has pushed so many Black, Latino, and immigrant families out. Pledging to do something better as we pledge to help rebuild New York possibly means that the racist, the anti-racist agenda that we are attempting to follow must be a part of how we choose, how we're going to act, what we're going to say, and what we're going to commit to do as an institution to make things better. It's very tricky, very controversial, but I don't see any way out of the dilemma that we're currently in unless we embrace the fact that we have to do better.
A question from our audience. How do we better support our Black colleagues, our Indigenous colleagues, and other colleagues and friends of color during these difficult times? How do we have discussions about race without white people dominating the conversation and creating a safe space where Black, Indigenous, and people of color feel comfortable voicing their thoughts around oppression?
I don't think anybody knows how to do this. We don't. That means that there's no textbook that we didn't manage to get that could have told us how to do this without problems, without pain, and without a certain amount of agony. I think what we have to commit to do is recognize that this is going to be extremely difficult. We don't know how to have those conversations. We don't know how to have those conversations in a way that allows us to preserve our own integrity, our own sense of identity, our own sense of who we are, our own sense of history, and not have those factors be a block that keeps us from creating the kind of society where racism, for all intents and purposes, is a historical memory. It means that we're going to have some very difficult conversations. We have to recognize that because we don't know how to do it, because there's no recipe, there's no template, as we have these conversations, there will at times be pain. People are going to feel badly about it. What we have to do is commit not to have conversations that are painless. We have to commit to have conversations that, with the pain, allow us to keep going so that we do better.
I also want to acknowledge that there's no template for doing this, but just remind everybody that some grace and understanding and simple "how are you" and "how are you doing" can take you really far. Also, I want to remind everybody to be really compassionate with the trauma that Black, Indigenous people of color are experiencing right now. And if your colleagues need some space and some time and don't want to step up to the plate right now, you have to create that space for them. It's just a basic concepts of human dignity. Let's apply those as a starting point and realize that moving this work forward and changing Columbia as an institution and changing the field of public health as an institution is going to take time, difficult discussions. It's going to be clunky. It's not going to be perfect as we roll it out, but extending some simple human dignities towards other people can go really far, and just providing the space where your colleagues can feel comfortable expressing where their needs are and where they think action could be taken.
A student has said, many of us are here only for a few years. How can we continue to push for institutional change and hold Columbia, the industrial complex side especially, accountable for responsible rebuilding work in the time we are here? And I would add, beyond the time that we're here for that student.
Well, number one, you don't go to heaven when you graduate. You become an alum. That simply means that you stay connected. I don't care where you are. I have connections with students who now are in France who really want to know what we're doing here, and have even been part of some of the demonstrations that occurred in Paris in support of all the things that are going on here. We are an international community. We are proud of the fact that we have networks that go all over the place. The idea is that you're only here for 2 years and then you go do something else. No. Part of what we're doing is committing you to something that I think is a lifetime of commitment to the goals and ideals that we're talking about here. And that means wherever you are, if we send out a call, hey, Columbia alum, we need you, you respond. You're not going anywhere. So glad to have you.
Also, speaking up goes really far. A lot of the changes that are being discussed this week are because of a student-led effort. And so if you feel willing and open to speak up and you have the space and you feel comfortable doing it, then continuing to speak up, because those things create incremental changes that you might not experience if you're here, for a year or two, but over the long term, they will go really far in contributing to the institutional culture and changing it.
Can I just say, when I was a student, I didn't realize the power I had, and I think the students are realizing, clearly the Black and Latinx Student Caucus is realizing that you have real extended power as an alum. You don't understand that right now, but you can call in as an alum, and the university leadership actually does respond and listen.
I'd like to go back to the question about what we can do for our Black, Indigenous, and people of color colleagues. Today is a day where many institutions are following Shutdown STEM. And I'm sure that some of you are aware of that hashtag, including major journals, the Lamont Doherty Observatory. The point of that was to shut down academia, to have a day of learning and action, as this work takes time. And you cannot do this work if you're also pretending to do everything business as usual. When my friends ask me what they can do to support me, I tell them that they can learn so that they can act in an informed manner. So in this country, our educational systems, whether you've gone to a public school or an elite private school, have done a great job of miseducating us about American history, and therefore miseducating us about who we are in relation to each other. I think moving forward, whether you are at Mailman for 2 years or more, when you leave Mailman, a large part of this work is learning and preparing so that you can act in an informed manner. There are questions that I'm receiving, and all questions are welcome, that show that as a community, we do and we will need to devote time to learning before acting. And so that's the first thing that you can do. There are a number of resources online. In the coming weeks, we will also share resources that we are going to coalesce around as a school. But that's the most important thing that can be done at this time for those who are just now entering conversations that for many of us are ingrained on our DNA. With that, we have 6 minutes left. And I want to allow time for some closing remarks from the Dean. I want to let you know that there's no way that we could have gotten to all of your questions, but we have the bank of questions. Those questions are going to be informing our work moving forward, and they point to resources that we need to share with you all. So know that we are not just taking your questions and not answering them. In the meantime, as we begin our plans for action, if you have any questions, please feel free to email any of us on this panel. Feel free to email any colleague or faculty member or staff member that you're comfortable with. This is a time for us to answer very important questions so that we can act. Dean Freed, I'd like to turn it over to you.
Well, thank you, Dean Diacqua, and thank you to all of my fabulous colleagues who have just spoken. I've learned a lot, which I appreciate. And I always feel immensely honored to be able to work honestly shoulder to shoulder with all of you to build a shared vision. And I think the work that you all have articulated and the goals you have articulated so importantly is central to what we need to be and where we need to go. And I believe that we don't have a question about that. We have a commitment. So I want to thank everybody. There are 400 people on this webinar, which is, I think, a sign of the vibrancy and the commitment of this whole community. And I believe that together we can build the next stage vision and action commitments, which are essential to building the institution that is anti-racist, that is inclusive, that is, as Goleen said, caring and supportive, and that is diverse. There's a lot of work ahead, as Dr. Fullilove just said. I have no question about that. We've all been engaged in this a long time and know there's a long way to go, but we are deeply committed to escalating what we've already done to a new transformative level and hope that all the 400 people who are on this Zoom call will be part of that. Thank you all so much. Thank you to our panelists. Thank you to Dean Diacqua for leading us today.
Thank you so much, Dean Freed. One final comment. I want to let you know that this webinar has been recorded, and so it will be sent out to those who have registered. And we are also planning to do more discussions like this as a school community, so look forward to that. In the coming week, please look to the correspondences that you receive about our next plans for action. Thank you so much.